Okay, we might as well get started. So good morning, everybody. My name is Professor Catherine Thornton, and I'm head of the medical school here at Swansea University. So many of you have already had a welcome about a little bit about the university, maybe a little bit about the Faculty of Medicine, Health and Life Science. But I'm here to introduce you to the medical school particularly, which I think is the best school at the university. And I'm going to introduce you some of the degrees that we have here. We're going to focus on medicine, of course, today. And then we're going to take out those who already have a degree to get some clinical skills exposure and some opportunity to chat to some of our current medical students. And then for those who are looking to think about what they're going to do for their first degree at university, we're going to talk about our pathways to medicine opportunities around our Bachelor of Science suite of degrees. So welcome to Swansea on this, very autumnal day that we're having. So these are what we're going to talk about. We're going to talk about our graduate entry medicine first, and then we're going to go into those pathways to medicine undergraduate degrees. And we have 5 degrees that fit that bill here at Swansea. They are applied medical science, medical biochemistry and medical genetics, medical pharmacology, population health, and medical science. And so each of these have a pathways to medicine in them, and the pathways you choose really depends on your personal interests along those different subject areas. And there'll be plenty of time for questions, time to meet students, and so on. I've already introduced myself. So today we're on the Singleton Park campus. Some of you will have come on off the M4 on Junction 42, driven down Fabian Way and driven past the Bay campus. But this is the Singleton Park campus. You can see a nice picture there. And of course, both campuses are really nicely close to the beach. And this campus is nicely embedded in Singleton Park. And anyone who's particularly interested in sports, you can see there's sports facilities over here. There's an Olympic-sized swimming pool, and the university has a swim team, and lots of sports opportunities if you choose to study at Swansea University. So why would I think about studying medicine at Swansea University? There's lots of medical schools around the country. Why choose Swansea for studying your medicine? Obviously, we're a graduate entry medicine program, so that gives opportunities to people who perhaps didn't get into medicine from A-levels or have done some other kind of degree and have suddenly developed a hankering to do medicine. But we're also an excellent medical school. You can see these rankings here. We're ranked 5th in the UK for medicine, according to the Times Good University Guide. We're 1st for graduate prospects for people coming from a medicine degree. So that means you've got an excellent chance of having a graduate level job at the end of your degree. We're 8th for research and teaching quality. So of course, that's going to be important as you study for your degree. And if you're doing that pathways to medicine option, then you may also be thinking about that research opportunity and keeping your options open for postgraduate study. And the Guardian University Guide that came out just this week, we're ranked 4th in the UK for medicine. And you can see those various things along the bottom here as well. And in terms of global reputation, Swansea University is in the top 300 for the subjects allied to medicine in the World University Ranking. So that ranks all the universities across the planet, not just the UK universities. So you're going to see some of these facilities when you're walking around today, but you're not going to be able to go into all of them. And this is just some examples of those. So you'll see the hospital, Singleton Hospital is just across here. And we have a teaching unit in that hospital. And for those who are local, will also be aware of Morrison Hospital, which is about 11 miles away. And we also have an education centre in there where our medical students have opportunity to undertake training, but doctors in practice and people in other healthcare professions can also continue their postgraduate training. These pictures down here are some of the facilities we have on this campus. So we have one building that's got some imaging equipment. There's an MRI in there, there's a CT scanner, and there's opportunities for teaching exposure in those environments. We have lots of clinical skills spaces where our students learn how to practice as doctors if you're doing medicine, but alongside other healthcare professionals, alongside students training to be nurses, alongside students training to be paramedics, which much better reflects the working environment you're going to find yourself in when you graduate. And you're going to see some of that today. We're a medical school, so of course we have an anatomy suite, and there'll be opportunity to tour through that facility today. If you're thinking about research, we have some very expensive, very high-tech, high-specification equipment where you may get the opportunity to undertake a project in the latter stages of your undergraduate degree and get exposed to that sort of high-level research environment. And then those who may be thinking about those pathways to medicine opportunities, We obviously have lots of teaching laboratories, and you're going to have some experience in that teaching laboratory space today. So you can see Swansea University is really well located here. We've got the campus where our students do the majority of their formal learning, but we're really close to Singleton Hospital here, and Morrison Hospital isn't too far away either. We've just opened what is called a simulation-based learning facility at Swansea University. And again, there's opportunities to take tours through this. And this is a fabulous facility. It's a state-of-the-art simulation facility that supports the education, particularly of our healthcare students. And it's part of a multi-million-pound refurbishment project that's underway on Singleton campus. So it's this immersive simulation center. It's got 8 immersive simulation suites, and this can be adapted. It's got what are called smart walls, and you can cycle through a healthcare scenario on those smart walls. A really good example is a road traffic accident. That smart wall could look like the side of the M4, for example, where there's been a road traffic accident. It can then be changed to look like the back of an ambulance, so the paramedics get their experience of interacting with that road traffic accident site. It can then be changed to look like the accident emergency unit, where the ambulance is going to arrive. And then it can look like the resuscitation room, the operating theatres, and so on, so that the students can practice working in that environment, and again, working with those other healthcare professionals. So we have that on this site, and we also have it on our St David's Park campus. And then we have Penshire, where we also have more education spaces. And as I said, there's lots of tours running there today. Here's a model of the space for anyone who may be thinking of going and having a look. And here's some examples of the exposures the students would get in that environment. You can see there's some assisted reality and virtual reality opportunities. We can see that smart wall example I gave you. And then you can see we have lots of simulation dummies, for want of a better way, mannequins, where the students can practice all kinds of scenarios as well. So lots of fabulous opportunities so that our students are really well trained before they get anywhere near a patient. So becoming a doctor at Swansea, the key thing to remember, it's a graduate entry program. You cannot do our medicine degree straight from A-levels. You need a first degree. You need a BSc typically. And it's a 4-year accelerated program. And one of the lovely things about our program is that early clinical exposure. Our students are having clinical exposure in the 5th week of joining us. So our current load of medical students started 2 weeks ago, and they're about 3 weeks from getting out into clinical practice. We use a case-based learning approach and a spiral integrated curriculum. So that means we have a topic of the week, and that will be a clinical topic, and the students will get all their learning around that space, from the basic science to the diagnostic to the treatment, interacting with a whole suite of different people along the way. So in terms of entry requirements, you need a 2-1 undergraduate degree. It can be almost any degree. We have students on this program who are not biologists, not chemists, not done those kinds of subjects. They've done theology, they've done business, they've done chemical engineering. So it's a 2-1 degree or equivalent, but you must have done obviously that 2-1 qualification, or if you've got a 2-2 qualification and then you've done a postgraduate degree. So someone who's got a 2-2 and has then gone on and done a master's degree and done well at their master's degree would also be able to apply for our medical program. You have to have sat the GAMSAT or the MCAT. You have to have achieved a certain threshold score. That threshold score changes year on year. And if you meet those above criteria, you'll then be invited to an interview, and you'll go through a series of interviews, and then hopefully you'll be selected and onto our graduate entry medicine program. As we've said, it's a graduate program. There are lots of advantages to being a graduate entry student. You've got a little bit more life experience, a little bit more maturity about your approach to your learning. You've got some university experience from your first degree. Medicine is tough and lots of work, and you're prepared for that because you've already had a little bit of practice on your first degree. You've already got that first degree, so it gives you some additional opportunities as you progress through your life. Your study experience is really rich. As I said, you're working with colleagues, fellow students who come from a huge diversity of backgrounds. They come from all over the world because we have a very small international intake, and they come from an immense array of backgrounds. And there's lots of data now that just shows that a student who comes from a graduate entry medicine program, especially our graduate entry medicine program, is amongst the best prepared for when they get out and practice as doctors once they graduate. And that's been shown by various surveys, including around the 7 deanery, which is our postgraduate deanery for our doctors. So those of you who've already got a degree could be thinking about already applying to study graduate entry medicine at Swansea. Those of you who are thinking about what to do after finishing school, maybe thinking about doing one of our Pathways to Medicine programs, which gives you that opportunity, if you perform well enough along it, to have a guaranteed interview for our program. We don't guarantee a place, but we do guarantee an interview. So those 5 programs are listed here, and here's their UCAS number down the side there: Applied Medical Sciences, Medical Biochemistry, Medical Genetics, Medical Pharmacology, Population Health and Medical Sciences. We have 10 undergraduate degrees in offer in the medical school. Only 5 of them are on the Pathways to Medicine. And if you're confused when you sort of look at the websites or the university's prospectus, look for the ones that have the word medical in the title. The other 5 don't, these 5 do, and they are on our Pathways to Medicine. All of these degrees also have a foundation, and you can progress from the foundation year onto one of these Pathways to Medicine programs and still be offered a place to interview for our graduate entry medicine program. So that means if you really don't do very well at your A-levels, but you do well enough to be accepted onto a foundation program, you've still got a shot at doing medicine in the future if you're very passionate about that. So you can, not do as well at your A-levels, get onto a foundation program, move on to one of these Pathways to Medicine programs, and then still have that opportunity around the place for an interview. So putting one of these programs is often an ideal 5th option. You can only put 4 medical schools when you're filling in your UCAS application. So you can put one of these Pathways to Medicine as your 5th application, as your 5th opportunity, and perhaps just give you a little bit of a safety net ahead of the final results from your A-levels. So now I'm just going to go into a little bit more about what our medicine degree actually looks like. We talked about early clinical exposure. We talked about a spiral curriculum, but what does that actually all mean? So we have our curriculum, the sort of scheme against which we're going to teach our medical students. And these are the key core. This is the core of our philosophy for teaching our medicine. So it's situated in the clinical setting. As I said, straight into clinical exposure in that 5th week in your first year. And lots of clinical skills opportunities. We gave a very specific example about the simulation facility, but also lots of rooms around the place where you'll learn how to take blood, you'll learn how to catheterize, learn how to do all kinds of examinations, which will prepare you for practice. It's very student driven. We expect the students to do a lot of self-directed learning. We point them in the right direction, give them some of the resources, tell them where the resources are, and send them off to develop maturity in their learning. We take a very spiral approach, introducing the basics, building on top of that, and so forth and so on through the program, and coming back always to revisit those basics so that they are well reinforced in people's minds. As we said, we do a lot of simulating of clinical practice. This gives the opportunity to have some essentially real life exposures without actually having to find yourself at a road traffic accident in the back of an ambulance and working in A&E using the example I mentioned before. We're a relatively small program. We have an intake of 150 in our first year of graduate entry medicine. So this means you still have that small program where you can facilitate high quality learning more easily, much easier to generate a supportive environment, and much more interaction between the students, and a lot of opportunity to do small group working and cycle the students through different opportunities and scenarios. And of course, we're always thinking about ensuring that our students are trained to meet the needs of patients and the public. That's what we want in our doctors of the future. And we want them to be able to think globally about global issues. We know about climate change. We know about all kinds of global issues, health inequalities. We want our students to be aware of that and incorporate that into their learning and their practice in the future. But of course, we want them to act locally. Ideally, we want many of them to stay in Wales, but of course, they also get dispersed right around the UK. Okay, so where is your medicine teaching going to take place if you come and study medicine with us? Obviously, we're on Singleton campus here. So this is the site where you'd have lectures, tutorials, demonstrations, laboratory work. Our anatomy suite is just down the back there. Our clinical skills rooms are through this building, through the building next door, and through the building next door to that. So all very closely located. And there's a lot of professionalism modules and activity within medicine, teaching our students how to behave in a healthcare setting, how to interact in a professional manner with public and patients and so on. There's opportunities to go into general practice surgeries. Obviously, working in general practice is a core skill that all medical students have. And so this brings community-based learning, and we have relationships with all of the GP practices across Swansea and beyond. And then there's opportunities to go into various hospitals, not just Singleton Hospital, not just Morrison Hospital here in Swansea. We've got Cefn Coed here in Swansea as well. We've got Neath Port Talbot, but there's also opportunities to go out to Carmarthen, Aberystwyth, Llanelli and Haverfordwest as part of that clinical experience that our students are going to get. And we take an apprenticeship style, which becomes more pronounced as students progress through the years. There's specialty attachments, people do pediatrics, obstetrics, and so on. And there's learning opportunities in the clinical setting. Students have a bit of freedom to select opportunities for themselves and build up a bit of a portfolio as they go through. So this is just a map for those of you who are less familiar with Wales. Here's us down here in Swansea with our different hospitals here. We've got Singleton here, Cefn Coed here. We've got Morriston there. Here's Neath Port Talbot Hospital. Here's Prince Philip out at Llanelli. Then we've got opportunities in Carmarthen, out here at Milford Haven, and up here at Aberystwyth. So very much focused on Southwest Wales for those who are less familiar with the geography of Wales. This is what the curriculum looks like. The top row here is year 1, year 2, year 3, year 4 going down here. And the key thing to note if you're a potential student is perhaps this blue block. These are the learning weeks. These are the kind of traditional university weeks. When are you sitting in a room like this learning? When am I sitting in a tutorial? When am I maybe in the anatomy lab? And so on. So they're your learning weeks. And then we have these other weeks where we have clinical opportunities dispersed through them. So these are these yellow opportunities, but you can see yellow is a constant through the program. So that clinical interaction is a constant through the program. And then the sort of larger chunks in which it occur just increase in number and duration as you go through. So you can see we've got this clinical apprenticeship here in the first year, alongside all those other clinical placement opportunities you're going to get. And then you can see that in the second year, there's a little bit more of that. And by the time you're getting to the third year, this different shades of yellow here, but all these specialty attachments are when you go into a specific discipline in one of the hospitals and get your clinical placement opportunity, or you go into the community and work in a GP practice. So you can see by year 3, most of your teaching is now in situ in a clinical setting, where you're going to get real exposure to patients and other healthcare professionals working with those patients. And you can see that by the time you get into the 4th year here, we start thinking of it about much more as a clinical apprenticeship. You're going to start working much more like the doctor that you're going to be by the end of that year, and getting you exposed to the environment that you're going to work when you start working as a junior doctor, which is the sort of terminology that I think most people understand. And there's, of course, an opportunity to do an elective, and many of our students will elect to go to some countries where there are healthcare challenges, so that they can learn about what those healthcare challenges are and perhaps incorporate that into their own practice. So that's the shape of the 4 years. So thinking about applying to our graduate entry medicine program, as I'm just summarizing what I said before, that GAMSAT score, so you have to sit the GAMSAT or MCAT, and as I said, the score does change year on year based on the sort of overall outcome of the entire cohort sitting that GAMSAT. You need that minimum 2-1 in a first degree, essentially any degree. It doesn't have to be a sort of biomedical degree is the key thing there. Or if you've done a 2-2, you can do a higher master's degree. So there's a real opportunity for people who may not have progressed as well academically as they wanted to, but still want to do medicine, or people who've done a different degree, wanted to pursue a different career, and then come back and do medicine. I know as someone who did chemical engineering, has come back and done our medicine program, and is now a plastic surgeon at Morrison Hospital. That was their career journey. And of course, you have to have done well at your GCSEs, English and Maths, grade C or 4 or above. And then we have a huge selection process after that, which is based on non-academic criteria. You go through 2 interviews and a piece of written work as part of the assessment for them. And during that process, you're going to be assessed for your communication skills. We all want our doctors to be able to talk to us, don't we? We don't want to go to our GP and the GP can't actually look us in the eye and have a conversation with us. We want people to have a passion for medicine and a resilience for medicine. They've got to be good at solving problems. They've got to be good at taking all those symptoms we bring as a patient and try and work out what's going on. We know medicine is a high pressure career, so we want to make sure that our students are able to cope with that. We need personal integrity and insight. We want professionalism. We all want to trust and have faith in our doctors. And of course, there'll be some referees' comments. There'll be a personal reference and an academic reference as well. So if we're thinking about entry next year for graduate entry medicine, The application deadline is the 16th of October, which is just a few weeks away. So our goal at the medical school here in Swansea is to train doctors for Wales. So we're a medical school for all Wales, at the forefront of designing and securing the medical and life science workforce of the future. So as a medical school, we train not only doctors, we train a whole host of other healthcare professionals and people who are going to undertake research in pharmacy and industry and in academia to sort of develop the technologies and treatments of the future. So we have that pathway to medicine in those very specific courses. If you're thinking about A-levels and what I'm going to apply for, this gives the opportunity for those interviews. We have about 1,000 applicants a year, and we interview about a third of them, and about half of those will then get through. It does vary year on year. And there is some eligibility for contextual interview places. So domicile, Welsh domicile, for example, will give you some extra points towards being selected for interview, the secondary school you've attended, and your region of origin. This is to encourage diversity within our cohort of our students so that when they're working as doctors, they're much more representative of the patients that they're looking after. So I think those of you who've already got a degree and are very much thinking about applying for graduate entry medicine in the next few weeks or in the future, are welcome to leave now and go and get some exposure in our clinical skills session and speak to some of our medical students.
Yeah, so basically those of you who've already got a bachelor's degree and are only here today for graduate entry medicine, as Kathy has just mentioned, we've now got a clinical skills tool for you. So if you want to follow our student, and then those that are studying their A-levels now and are looking at our undergraduate degrees, you stay here and we're going to go through our undergraduate degrees now, okay? So applied medical sciences, medical biochemistry, medical genetics, medical pharmacology and population health. We're going to go through those now, okay? So you remain here and you get to have a clinical talk at the end of your talk in about 20 minutes.
Take care of which gets
Yeah. Okay, so just so we're checking, double checking, I want to make sure everyone's in the right room. So now we're going to be talking about undergraduate pathways to medicine degree. So they're all on screen here: applied medical sciences, medical biochemistry, medical genetics, medical pharmacology and population health and medical sciences. And I know there's a handful here of people who are also here for biochemistry and genetics as well, which Kathy will also cover. They're not part of our pathways to medicine, but they're still a degree that we do here in Swansea and our joint biochemistry and genetics degree. So we'll cover that as well. We're going to keep you for about another half an hour for this presentation, but then you will also get an opportunity to go and see our clinical skills and our labs as well. Okay.
Thank you. For those thinking about doing biochemistry or genetics, I have a biochemistry degree, so welcome to the room. So thereafter, we're going to focus on those pathways to medicine, but we're going to touch about our other programs because they don't run divorced from each other. All the students come through with shared opportunities along different modules and with all the sort of coursework and practical work that we do as well. So that's just reiterating those 5 degrees and the UCAS numbers, and highlighting that foundation potential. So we have students on our graduate entry medicine program at the moment who didn't do as well at their A-levels as they had anticipated. They didn't do well enough to even get onto a BSc degree, but they got onto a foundation degree, and then they've progressed doing really well through our undergraduate degrees and have actually then got on to do graduate entry medicine. So it's a lovely story, that opportunity. And as I've already said, it's that ideal 5th opportunity on your UCAS application. If you're on the pathways to medicine, there are different things about those degrees that make it the pathways to medicine. So what we have is a bespoke module in the 2nd year. In the 2nd year, you get to do a module called Doctors, Patients and the Goals of Medicine. I can never remember it. Doctors, Patients and the Goals of Medicine. It's taught by a lot of our clinical colleagues, and it introduces our students to actually what it's really like to work in the NHS, work with patients, work with other healthcare professionals, and get a real flavour of what it's actually like to work as a doctor. And this is a really interesting module because we have students who join our pathways to medicine absolutely determined that they're going to be a doctor. They do this module and I think, oh my God, that's the last thing I want to do. But they're still doing their degree and there's still got lots of opportunities. Equally, we have lots of students who are like, nah, maybe medicine, maybe I don't really know, maybe it's an opportunity. They do this module and they fall madly in love with medicine as a potential career. So it's a real opportunity to get some real insights before you commit to actually studying medicine. You get to do lots of healthcare related observations. There's an element of placement in there, but we also help the students get ready in terms of applying to do medicine once they finish, preparing their personal statement, help them learn, help with guidance around how to do the GAMSAT exam and how to study for that. Our current graduate entry medicine students who've come through our Pathways to Medicine come back and offer insights to our students doing this pathway. They also do some tutorial work with them related to sitting the GAMSAT exam. So there's really nice peer-to-peer mentoring in students who've come through this pathway, got onto our graduate entry medicine pathway, and come and help the next cohort of students to maximize their opportunities. So if you do well enough along the degree, so you have to get at least a 2-1 on this degree, you have to have got a good mark on that bespoke module, so you've got to get 60% or more. You've got to achieve a certain level on your GAMSAT exam, but it's not as much as everybody else who's applying from outside has to achieve. And if you do that, you'll get a guaranteed interview. The key thing is, again, it's not a guaranteed place, it's a guaranteed interview for our program, but you have to meet those criteria all along the way. Get a 2-1 overall, 60% on that module, and you've still got to do well enough on your GAMSAT. You just don't have to do as well as the outside applicants. We lower the GAMSAT for them. So how does this Pathways to Medicine work? You choose one of those Pathways to Medicine undergraduate degrees, and all 5 degrees have the same opportunity. So your choice of degree is very much driven by your personal interests. We have people who choose medical pharmacology because they are actually really interested in drugs and medicines and how they work and so on. Whereas we have people who are desperate to get some anatomy experience really early on, and so they would do something like applied medical sciences. So the opportunity you get through these degrees is you're already starting to study the science that underpins the study of medicine, but you can tailor it a little bit to your personal interests. There's that bespoke module, Doctors, Patients, and the Goals of Medicine I've mentioned. There's those healthcare related opportunities. There's that advice on preparing medicine application. And these are some of the things now written down that I've already told you. You need to get that 60% average overall. So that's a 2-1 or better. You need to get 60% on that Pathways module in the second year. You've got to sit the GAMSAT. Many of them will sit at the end of year 2 or the beginning of year 3. And we have some students with us today who can tell you about their personal experiences with the GAMSAT. And then you're eligible for that guaranteed interview slot here for our graduate entry medicine, as long as you achieve that minimum GAMSAT score, which does change year on year. That's the graduating with the 2-1 or above. And then if you interview well, then you'll be invited to join our degree program and you'll go on to study medicine with us. Now we have a Pathways to Medicine on our degrees, but students who are perhaps thinking, oh, I'm pretty sure I'm not interested in medicine, but I'm really interested in biomedical science. I'd like to work in this space. I'd either like to do some research in the future. Maybe I'd like to be a science teacher. Maybe I'm thinking working with big pharma, the AstraZenecas of the world may be really interesting. So in addition to our Pathways to Medicine, we do have other pathways that run through our programs. So there's a pathways here where you can go on to do medical science research. And again, you'll get opportunities throughout your degrees to learn about the underpinning science, to get some research experience, and to start getting, again, some real exposure to what it might be like to work as a research scientist. We have an enterprise and innovation pathway. So the students who think they have an entrepreneurial flair, they may be thinking that they're going to develop new products and processes that are going to change the world, or at least change a little bit of the world. And they may want to get some underpinning skills that are going to help with that. So there's that opportunity there as well. And then we have that medical science in practice, that Pathways to Medicine, which I've already told you a little bit about. We do also have the opportunity in the third year to focus more on teaching of science in secondary school for those who may be interested in becoming a teacher in the future as well. And they can do a particular module in the third year of their degree. So one of the key things about the Pathways to Medicine is it keeps your options open. So if you're thinking maybe medicine, or you're thinking definitely medicine, you can do this degree. You can learn a lot more about what it's like to actually work as a doctor and to study medicine in the future, get a little bit of experience behind you, get some of the underpinning knowledge and skills. and really inform your decision about whether you want to go on and study graduate entry medicine. So you'll build that really solid foundation in the medical science field. If you do well, it's a really good springboard into graduate entry medicine program with us. But of course, other graduate entry medicine programs are available as well to you. You just wouldn't have that guaranteed interview. And of course, all of our degrees have embedded in them transferable skills. We don't want our students to come out just able to do that one thing that they were aspiring to do. They need to be able to be flexible in terms of, changing aspirations as they progress. And this is the approach we take to teaching our undergraduates. So we have year one. So again, you're just building your fundamental skills, getting those core skills in development. You'll be in the lab learning basic laboratory skills. You'll be learning basic statistical and, data handling skills, which will be important for anybody doing these degrees, irrespective of the career journey that they then take. Into year two, you'll start working in groups, which is much more reflective of the real world. And you'll start looking at those different employability strands. Am I on the pathways to medicine? Am I pathways to research? Am I thinking about innovation or science teaching and so on? And then in year three, you're becoming, so hopefully, an independent worker, an independent thinker, and you'll all get the opportunity to do some kind of research project. It doesn't matter which pathway you're on. If you're on the science teaching pathway, you get the opportunity to get some practice in a local school and do some learning and research around that. If you're on any of the other programs, you'll get a research opportunity, which will be as tailored as much to your interest as possible. Lots of our students on the pathways to medicine may work with our clinicians, may work with our scientists who work closely with clinicians, and maybe do some work in patient-reported outcome measures or handling data from a clinical trial and those kinds of things, whereas those on the pathways to research may want a little bit more laboratory experience where they get to rattle test tubes and use pipettes and things like that. So again, that opportunity which can be very much tailored towards what the students are interested in. We've just got this little film here talking about that 5th choice on your UCAS application.
Pathway to Medicine is a structure that exists within some of our BSc programs. It's for students who want a guaranteed interview for our graduate medicine program. They're keeping their options open, possibly as a 5th choice in a UCAS form when they're applying for undergraduate medicine, or they know they want to do a first degree before they apply for graduate medicine. Mostly medical science type degrees for students who explore their passion for medicine. There are a range of other career options which our graduates go on to, but there is that pathway that goes to.
The Pathways to Medicine courses are an excellent foundation for going into graduate entry medicine because firstly, it gives you a chance to go to Swansea and to get a little taste of what it's like to be in university. It's also a great backup choice if, like me, you don't get into medicine the first time. It gives you another chance to apply through your 5th choice and to get around to medicine in the long run. It also prepares you for what it's going to be like to be a doctor and to work with patients every day, and that's invaluable.
Okay, so these, I'm now going to go through each of the degrees we have on our pathways to medicine, so you get a little bit of a flavour of what's different about them, because that can be quite important, choosing which of those pathways to medicine you might want to do. So we have applied medical sciences first here. And so this is really all about that science that underpins medicine. Here you're going to have anatomy in the first year, and then a suite of other opportunities as you go through. And you can see some of the key topics covered here. I've mentioned anatomy. You get to have physiology exposure as well, learn a lot about cell biology and genetics and how cells work. Pharmacology, again, a little bit of pharmacology, how medicines are going to affect the body, neuroscience, immunology, all kinds of other things. And very much focused on their clinical and applied relevance. So they're really offering you that springboard to progress on to graduate entry medicine, but equally you can progress onto a research pathway or a teaching pathway or an innovation opportunity in the future as well. And so it's simply this translational approach of taking our students learning through the bench to bedside experience. So the things we do at the laboratory bench that inform, the development of new drugs that are then used at the bedside of medicine, the development of new tests and so on. And lots of hands-on opportunities and lots of varied styles of teaching and assessment throughout all of our degrees. Here's medical pharmacology. So here, if you're particularly interested in maybe chemistry, and how medicines and drugs work. Medical pharmacology may be the degree for you. And again, some of the things will be looked at as drugs, as medicines and tools. How are drugs used therapeutically? Why does this drug work in this setting? What effect does it have on the cell? What effect does it have on the disease? What effect does it have on me as a human being? How can drugs help us discover how the body works? We can use drugs to understand intricate cellular processes and inform our future development of new therapies. And of course, we all know that drugs and other chemicals can be harmful. So can we understand those harmful side effects? Can we harness those harmful side effects in some way? And here's some of the things you would do down here. So toxicology. So, what are potentially the ill health effects on a cell and on a body? Chemistry, of course, is quite important here. Then you've got genetics, reproductive biology. You get to do some physiology. You get to do immunology with me in the second year. Pharmacogenomics, some neuroscience, drug development. So there's lots of shared modules across all of our programs, and then each program has its very bespoke, tailored offering as well. Then we have population health and medical sciences. A lot of people aren't really familiar with this as a topic when they're first exposed to our degrees. And up here, you can see population health is really taking approaches that seek to develop new knowledge and effective strategies to improve health and well-being and reduce inequalities among population. So it takes a lot of big data and tries to understand trends in disease, trends in treatments, vaccination use. The groups who work in population health at the medical school have just published a paper on the uptake of vaccines by pregnant women, COVID vaccines by pregnant women, which women choose to, which women don't choose to, those women who don't choose to, why don't they do it, and so on. So they do that kind of work. So it's a little bit more than public health, because you go back and you're thinking very much about that biological traceability, because you've got insights into how cells and organs and whole humans work as well. And so the advantage of this one is if you're a bit more interested in social sciences, epidemiology, a little bit of data wrangling and so forth, this may be more your style of degree to take you towards medicine. And there'll be lots of opportunities when you're practicing as a doctor to really bring this into your practice as well. Then we have biochemistry and medical biochemistry. So we have the biochemistry program, which some of you were interested in. Both of them are studying the chemical processes that occur within living organisms, within cells. But within the medical biochemistry, we have that opportunity to do that pathways elements, thinking about very much the medical application of biochemistry rather than biochemistry in its entirety. So here you're going to talk about metabolic regulation. You're going to get lots of molecular biology skills. You're going to spend a lot of time talking about cells. So if you're really interested in cells and how cells work, and how making sure cells work properly ensures organs work properly and has an impact on disease, then this may be the route for you. And you're going to have lots of opportunities to bioinformatics as well. How do you wrangle those big data sets into something meaningful? Then we have genetics and medical genetics again. So we have genetics for those perhaps not interested in becoming a doctor in the future, but we have people on this program interested in becoming genetic counselors, for example. So again, you're understanding those building blocks of life. What's going on at the DNA level? What's going on with those nucleotides? What's going on with gene expression? And so forth and so on. And again, that medical genetics opportunity where you get that pathways to medicine module and some bespoke modules which are much more focused on the genetics of human disease, for example. So you can see down here, we've got this human and medical genetics opportunity here. The genetics of cancer, for example, huge interest in that. Lots around biostatistics, evolution, and how that's impacted on and by genetics. So, as we said, there are medical sciences programs that are linked to our pathways to medicine. I've touched on the biochemistry and genetics because for our biochemistry and genetic programs, you can kind of take the option of doing straight biochemistry, straight genetics, or the medical genetics, or the medical biochemistry, depending mostly on your interest in becoming a doctor in the future. You can also do a combination of biochemistry and genetics. As I said, we have a foundation year on all of these programs, whether on pathways to medicine or not. And on our biochemistry and genetics programs, we have an MSci opportunity, which means you can do a 4-year program and you can do a last 4th year, which is much more aligned to a master's level, and you get lots of research experience doing a 10-month research project. So this is really designed for someone who has a real hankering to be a researcher of the future. So thinking about your studies at the moment, what are you going to have to achieve for your A-levels to be able to come and study with us? So here's our undergraduate degrees, our BSc MSci offer range. So for most of our programs, it's an AAB to BBB at A level. Obviously, we take equivalents as well, BTECs, etc. And your most relevant subjects are biology and or chemistry, plus one other STEM subject typically. So the maths, the physics, the psychology, and so on. Here's the BTEC scores down here, the D star, D star, D. And again, a good biology and chemistry profile within there. Here's our international baccalaureate outcomes here as well. And also noting that you need to have done well at GCSEs, at least a grade C4 for maths and English again. But one thing Swansea is really well recognised for is having a conversation with students. Having a conversation with students, and maybe you didn't quite get what you wanted, and there was something that happened to you. Maybe there was some family crisis or personal crisis that sort of curtailed your ability to put in your best effort. So we always take personal circumstances and personal statements into consideration as well. And we always encourage people to speak to us. Speak to us, you know, during the UCAS application process. And again, we do this a lot through clearing. We have a lot of one-on-one conversations with people through the clearing stage and talk to you about what it is you want to achieve with your degree and where the opportunities to study with us might be. And this is our foundation year. What if you don't have those entry grades? We offer that additional year at the beginning ahead of those BSc opportunities. So this again helps you build the foundation, gets you, experienced in what it's like to learn and study at a university, or you may be a mature student returning to education. You want to cut your teeth before you commit to that full BSc degree. So it's going to give you that introduction to some of the key concepts, etc., that you're going to need to progress onto the BSc degrees. And we have good progression from our foundation years into our full year our 3-year BSc program, sorry. And so you need a 60% average in that foundation year to be able to progress onto it. But I think it's something like 85% of our students will happily achieve that and be able to progress into those BSc opportunities. And as I've already highlighted, you can still benefit from Pathway to Medicine. So, you know, you haven't done as well in your A levels, you haven't even got anywhere near a BSc opportunity, let alone a medicine opportunity. You can do one of these foundation degrees and then progress onto the Pathway to Medicine. And as I said, we do have current gen students who have taken this route. And our typical offer here is BBC to CCD at A level, but I know that we go a little bit lower than that. As well, having just been through clearing. But again, those most relevant subjects are the biology and the chemistry. You don't need both for most of our degrees, you need one or the other. But again, have the conversation with us. We chat to people, we discuss what has happened in terms of why maybe they didn't do as well as they're anticipating, and then we can speak about personal tailoring of opportunities for you. So we have this experienced admission tutor team related to each of the programs, and they will look at your applications, and they're also the people who have a chat with you on the phone if you feel you need that as well. So they can exercise this discretion in interpreting the evidence that you provide. I'll give you an example of recent clearing. We had somebody who hadn't done very well at the A levels, but they're a mature student returning, and because they had had years of experience that was relevant to the degree, we were a little bit more lenient of their actual marks because they had lots of relevant real life experience. And so we have lots of examples like that. So we will consider your academic qualifications, we'll look at your predictive grades, we'll look at your personal statement, we'll look at your referees' comments, and we'll look at any other things you want to bring to the table and consider all of those in making a decision. And if you're on our Pathways to Medicine degrees, you do not need any previous clinical experience. Don't worry that you haven't helped out in an aged care home or something like that. We don't require our Pathways to Medicine students to have any experience. We would anticipate that you get some experience during the degree. There's lots of opportunities both within the medical school and across the university, because that will help when you're applying for graduate entry medicine. But there are no entrance exams, there's no interviews for our Pathways to Medicine. It's based on that UCAS pack of application, the academic qualifications, and all those references we take as well. So we've been focusing very much on Pathways to Medicine, and that is a career opportunity of the future, but there's lots of careers that people will be qualified for. I've already mentioned that I did a biochemistry degree. I'm a researcher here at the university. I'm not a doctor, I'm not a nurse, I'm not a midwife, I'm a researcher, I have a degree, I did a PhD, I've done research, and I sort of sit into this academia research opportunity here. There's lots of postgraduate opportunities, there's master's degrees, there's PhDs and other opportunities. You can move into research development. So if you've done medical pharmacology, pharmaceutical regulation may be a real opportunity for you. There's lots of interest in health data science, health informatics, and the use of large data sets in informing health and well-being. Lots of health professions. We've talked about our pathways to medicine, leading on to medicine. Then our pathways to medicine has also taken our students off to do physiotherapy. It's taken them off to become a physician associate. So lots of other healthcare professional opportunities that have postgraduate training available on them that our pathways to medicine really prepares our students for. People move into the pharmaceutical industry. We've had people move on and do patent law. We have people working in biotech. I have a student who worked with me. He did his degree here. He's just finishing his PhD, and he's working at a biotech company in London because of the skills and opportunities we gave him through his degree. People move on and do medical writing. I've mentioned research. There's opportunities to work in hospitals and do research as well. People move into patient advocacy. We have people who move into the food and beverage industry. There's telehealth opportunities, health promotion, all kinds of career opportunities that come from these different degrees, not necessarily just the study of medicine. We have a few funding opportunities to our students who study with us. We have these excellence scholarships, so students who get a AAA at A level, and merit scholarships for the students who get AAB. There are income-related bursaries as well, linked to household income. There's Welsh medium provision across all of our programs. We have it in our graduate entry medicine program. We have it in our undergraduate programs. If you're interested in learning through the medium of Welsh, we can offer that on many of our modules. And then we have various scholarships across the university, international music, sport, etc. And there's a web link there for those opportunities. This is just highlighting the opportunities to study through the medium of Welsh. There's been massive growth in this. There's opportunities for scholarship, there's designated accommodation, and we do have modules where you can do your learning in Welsh, you can do your coursework in Welsh, you can be assessed in Welsh if that's what you so choose. So lots of opportunities if that's what you're interested in. There's obviously accommodation on this campus, accommodation in the city centre, accommodation down the Bay campus. So lots of opportunities for accommodation. So there's some tours running of the facilities on this campus, 11 a.m. to 3 p.m. And I can't think where I'm at, but accommodation is up the back here. And then there's lots of accommodation, as we said, in the Bay campus, and there's some private providers. Anyone who knows Swansea will have seen all those student towers going up in the centre of Swansea. Great place to live, really new and lovely. But there's opportunities there, and we make a guaranteed accommodation agreement up to so many weeks post clearing. So that's also good as well. Parents, I'm the parent of a child who would have just finished A-levels if they hadn't dropped out. So a few months into A-levels. So I'm always very impressed with the parents in the room who've got their children to near the end of A-levels and looking at university, because I didn't manage it. But there's a lot of advice here for parents about your child applying to university and talking you through the process related to things like accommodation and finance and all of those kinds of things. You know, you might want to find out what it's like, what does Swansea really like to live in? What are the, you know, what is it going to be like in terms of my child going out? Do I have to worry more in Swansea than I would anywhere else, and things like that? So lots of opportunities there. So we have a student ambassador.
For prospective students, that some of the best people you can speak to at an open day is obviously those current students. So these guys are studying with us at the moment here at Swansea. So they're doing the degrees that we've talked about today. So they're each going to introduce themselves, explain which of the degrees that they're studying, and there's an opportunity then for you to pose some questions. Once we do the panel, we're then going to be taking you on those tours. So we're going to split the group into two. Half of you are going to go to our clinical skills first. The other half are going to go to our lab. We'll see one of our clinical teaching, one of our research teaching labs, and then you'll swap. So you'll get to see both, okay? But before that, so I'm just going to ask you to introduce yourself and which degree that you're studying.
Hi, I'm Abby. I started here in 4 years ago, doing the foundation year in population health and medical sciences. I didn't come through clearing, but I did my A-levels in 2012 and they were in English, Welsh, Media Studies and RE. So I didn't have the backing for a BSc. So I went into the foundation year knowing full well that I wanted to do medicine, and I started medicine 2 weeks ago. So I've completed the pathway and I'm now a medical student.
Hi, I'm Tommy. I'm a third year medical biochemistry MSci student. So a lot of people will probably hear from. I actually decided after applying for medicine, I didn't want to do it, and I wanted to go into research. And I came to Swansea because of the MSci program and the fact that it's integrated and allows you to do it. And yeah, I'm almost at the end of it now. I've got 1 year left and I'm really enjoying it. I've just finished interning at Praxis with Klein over summer. So there's a lot of opportunities in industry and pharmacy, but research as well. So I'm happy to answer any questions.
My name's Safia. So when I was doing my A-levels, I had an offer to do medicine, but I didn't get the A-levels that I needed. So Swansea offered me applied medical sciences. I did 4 years, but I jumped through the foundation because of some family problems. And I just graduated with the first class, so I'm planning on going into graduate entry medicine, and I just like the candidate. So if you need any help regarding that, do let me know.
Hi, I'm Lucy. I did my undergrad here too as well. I did medical genetics, and now I've also just started graduate entry medicine 2 weeks ago.
Hi, I'm Chelsea. I'm actually in biochemistry at Swansea. I'm not on the pathways medicine, but I'm on the research kind of pathway, and I'm thinking of staying on that pathway and making things
Okay, great. So as you can see, we've got a really wide range of our students here that are studying the breadth of our undergraduate degrees that we have on offer. Does anyone have any questions, or we can kind of talk about some general? Yes?
Yes, yeah, a little bit confused because now there are different ways to join the undergrad medicine degree. So there is the one which we can go directly from A-level after getting A, B, or B, and this will be 4 years program.
It's a 3-year program, three-year BSc program, and these are the applied medical sciences, medical pharmacology, population health and medical sciences, medical biochemistry or medical genetics. So they are the 5 courses you can come straight from A-level into undergraduate study. You would need to complete the 3-year BSc degree, and then you go on to study medicine at graduate entry level, which is a further 4 years. So it's a 7-year duration.
When you get the grade, the acquired grade in A-level, you have to force to get the 4th year, which is the foundation.
You can, yes. So that foundation year is there as an option. So if you don't quite meet the 3-year BSc entry requirement, you can do an additional foundation year and then progress on to the 3-year BSc.
Excel was if you are run out of your 4 options and you can enter the 5th option, which is best of engineering, the best of medicine. So you have to complete 3 years, and in your 2nd year you can apply for graduate, and after that complete the 3 years. So you will end up by 3 plus 7.
It's 3 plus 4. So our graduate, our graduate entry medicine program is 4 years. Yeah, so you're quite right. You've got it. You understand it completely. So well done, Kathy. You explained it very well. Yeah, that's right. So it's a 3-year BSc. And yeah.
If you get
Yeah.
The shortest medicine degrees are if you go straight from A-levels and do medicine. Some of them are 5 years, some of them are 6 years. So it is quicker than our pathways, but our pathways creates opportunities for students who didn't make it on to medicine after A-levels. So 85% of students who apply for medicine from A-levels will not get into medicine. So these opportunities really cater to those students who haven't got that opportunity.
What is the success rate for A-level?
15%.
15%, 1/5. Thank you.
Not for this, though, for undergraduate.
For undergraduate medicine, that is not for us. No.
And even though obviously we've said it's AAB to 3Bs at A level as an offer, that's an typical offer we make main scheme when you apply to us through A level. But when it comes to A level results day, then we are very flexible here in Swansea. So what we say to students, if you don't quite make your offer, we give aspirational offers to students because we want you to do really well at your A levels. We would be doing you a disservice if we said, you know, we set you two Bs and a C. You haven't got that aspiration to do as well as you could. So, but if you don't quite make those A level grades when it comes to results day in August, please get in touch with us, and we work with all of our students to find the right degree for you. And we've all just spent the last kind of 6 weeks doing that with students ready to start with us now in the coming weeks. If I come back to our student ambassador, so did anybody move to Swansea from far away or outside of Wales, and how have you found that transition becoming a student in Wales and particularly within Swansea?
So I grew up in London, so my mum was not happy when I came to this is very far away. But honestly, I love it. I grew up in the hustle and bustle of London, and it's much quieter, which has allowed me to focus more. But that's not to say that Swansea's boring. There's still a lot that you can do. There's beach right well, when the weather's good. But the beach is right there. There's a lot of student opportunities, so I've loved it. And also everyone in Wales is really nice compared to yeah.
So I moved from Swindon, so that's like near Bristol, Oxford. I moved with my family actually because I'm the only child. But when we moved here, it was kind of hard at the beginning because obviously for me, I have like specific requirements through like a long route and like meeting like people from my country. But the societies and university gave me that chance to meet like-minded people. And I actually like not just in Swansea, but we collaborated with Cardiff University. So you know these charity events and stuff. So I did meet my people and people that I like, you know, that I used to know. So.
And Lucy, you mentioned, so you've done an undergraduate degree, you've done that interview now for graduate, and that you've been successful. How did you find that pathways module in your second year doctor patients and the goal of medicine?
Okay, so the pathways module is really beneficial for you to sort of get a bit of a taste for what you might be getting yourself into with a medicine degree. Because even though at the time, well, at undergrad, so when I didn't get my A levels, I was thinking, oh, now it's going to be 7 years or longer if I don't get in again. But actually, it's gone so fast, and that module was really good. The lecturer that does the module as well does medical teaching on the module. It's amazing. You'll have a great time with him as well. And we even had like patients come in just in that module for our undergrad. We got to meet the patient and their family spoke, and it's really, I don't know, in your undergrad, that module really tries to show you sort of what you could be getting yourself into, and it's realistic. Like they do tell you what sort of the entry rates are and things, and who gets in and what to do. They really support you if you want to start writing your personal statement. The lecturers are really open to sort of helping you with sort of ideas and things, and if, I don't know, improvements and things. So it's a great module to go through if you are interested in doing medicine. And if you're not sure whether medicine or not medicine or research, it's still a great module to do because I really enjoyed it. You have to write a reflection on sort of placement that you do. So that's really beneficial just for general life. Like reflecting is something we should all be doing for like self-improvement and things. So that was beneficial as well. I think it's a really nice module. And what I would say about the graduate course already is I've met people all different ages from all over, and there's like musicians, there's a dentist, like I've got friends who are 10 years older than me, or like, and we get on so well, and it's like great to have a flavor of like everything, and you might not necessarily get that at undergrad with medicine. I feel like I'm more mature now. I don't know. And even though at the time I was like, oh, I wish I could have done this, looking back, I'm like, actually, maybe it works out best for me, and this is what was meant to happen. And sometimes things happen for a reason, I guess. Or I like to believe in that.
Yeah.
And we talked earlier today, if anyone went to the welcome, about the number of societies and the opportunities we have for our students in Swansea. Are any of you members of any certain societies you want to share with the group today?
So I'm a member of the Biochemistry and Genetics Society. So when you join Swansea, you can join your courses society, and they help you with like anything academic, or if you want to meet other people who's doing your course from other years as well. So there are events and socials that you can go to and help people on the course. And I also joined the African and Caribbean Society. So there are like over 150 different societies here in Swansea. So for example, we have the Tree Society or the Wine and Cheese Society. So we can find a society that you aren't interested in, you can actually make your own society. And yeah.
And about accommodation, so where did you guys stay in your first year? Do you want to talk about accommodation?
So I lived in one of the private partners, Seren, for the 3 years that I've been in Swansea, and I will say that compared to other universities, Swansea does have a good roster of it's a lot of accommodation at Swansea. So I would definitely highly recommend it. But also I had friends that lived on campus. I was kind of jealous of them because they could come to 9 a.m. having woken up at 8:15 and they were fine. But yeah, so there's definitely a lot. Just pick what you think is going to work best for you. And I would also highly recommend getting a shared room. I know it can be scary, living with people that you might not know, but that's how you make friends for life. That's how I made some of my friends. So I would highly encourage it as well.
Any questions from the room?
With private accommodation, are the people, if you have a shared flat, are the people in your flat guaranteed to be your age, or do you have like mixed?
So all of the private partners do, like, they'll question you when you apply, like, do you want to be in a single sex flat? Do you want to be in a, like, they will ask you what course you do as well. So I had pretty much everyone on the pathway, everyone was doing one pathway to medicine course in my flat in first year. So they're quite good at making sure that you will be welcome to.
They will try and group you in your subject areas, so they'll do their best. They obviously can't guarantee that, especially when it comes to maybe those students who apply through clearing, but they will do as many of your preferences. So what I'll say is, when you apply for your accommodation, the earlier you apply for your accommodation, the better. Once you accept your offer and you make us your firm or your insurance choice, you'll prioritise then to get that accommodation that you want. Okay, so for all of as much information as you can in your accommodation application, and you do that once you apply to us. After the January UCAS deadline, then you start to look at your accommodation options. And our accommodation team are here today. So where you registered in Taliesin this morning, if you want to go on an accommodation tour or speak to our team, go back to Taliesin Theatre and they'll happily have a chat with you about the various options, the different prices, and everything that we, the different availability to you as well. You can have a little look at some of the accommodation that's on campus today as well. Yes.
I just asked the other internship. So did you have to do that off your own back, or did you help you with that placement?
Yeah, so the Swansea Employability Academy did help me. They were, because in first year I was like, oh, I want to do research, but I didn't know how to get into that. So I remember going to them and I was, oh, please. And they were really useful in signposting me all of these job postings, helping me set up my LinkedIn, signposting you to all of the sites that are made for students to apply to things as well. And that was how I ended up getting it. So yeah, they're really thorough.
Yeah, it's a dedicated team there to help support. We can't guarantee that everybody will be able to go on the placement that they choose, and the placements are not guaranteed, if you like. So you, as a student, it's on your own back to apply for those opportunities, but we have a dedicated team who are there to help support our students in doing that.
And then you have got Swansea specific placements with industry or with
So there's lots of different opportunities. So we have companies that are based with us in Swansea as well, and so some companies that we do research kind of projects with, and they will open things like summer placements for those students as well. We do things like week of work as well, it's called. So there's week opportunities. So there's a huge range of different things that you can do once you become a student, and that team are there to help support students in doing that. A lot of our academic teaching teams and individuals will help support and navigate students as well. So Dr. Sarah Pryor is with us here today as well, who teaches on our Applied Medical Sciences programme. Sarah's going to be around at the end as well, up in our what we call our parents Q&A room, and we can answer any questions you've got as well. If anybody, for those parents who don't go on the tour, we can kind of answer any of those questions you might have as well. So finally, I was just going to ask about cost of living, because obviously we know that that is a really concern for people at the moment. You know, it's expensive going to university anyway, but it's particularly during this time. How do you find the cost of living here in Swansea as a student?
I feel like it's not cheap, especially because I moved with my family, so we were looking for a house, and houses in general are cheaper compared to Swindon. So yeah, it's much cheaper and it's affordable.
I haven't had any money since they opened Greg's here, but.
Okay, any other questions from the room? There will be plenty of opportunities as well on the tour, yeah?
Does Swansea University offer a opportunity for current A-level students to experience medicine and to be sure that they will take medicine as well?
So what we started this summer just gone was our summer school. So there will be a summer school available to you guys to apply for, and we'll be doing that in July next year. So it's usually aimed at year 12 students, so those that are just starting their A-levels. So that will become available on our website very shortly once we announce the dates. But we also do a various number of live webinars, which brings me on to the next slide. So we have our next series of webinars, which is called Current News, and they're going to start on the 25th of September, and they run until the 5th of October. So there'll be opportunity to hear about medicine as well. We do take at different parts of the work experience, but it is on a small scale, so it's not something that we offer to huge numbers. But if you are interested in something like that, you can get in touch with our team following today. So this is how you get in touch with us. So you can email us at studyfmhls@swansea.ac.uk. That comes to myself and my team within our recruitment team. We'll be able to answer any specific questions that we're unable to answer for you today. So we do have our admissions team here today in Taliesin where you registered. So if you're not sure if you're eligible for our programmes, you can go across and speak to our admissions team. They've got a little admissions stand. You can have a chat with them. But anything that we can't answer today, drop us an email and we look at this daily. All of the courses we've covered today are on our website. So if you go to swansea.ac.uk/undergrad and then courses, you'll be able to find them. They're listed A to Z. And then we're on the various social media channels. So we post daily across Facebook, Twitter, Instagram, for example. So make sure you follow us on the various social media. So for the rest of today, so we're going to be splitting you now into two groups and be able to take you on some of our clinical tours. But the rest of the day you can tour the campus, so they're going to run until 3 o'clock today, again from outside Taliesin where you registered this morning. We've got our brand new SUSIM facility, which you will be one of the first visitors to attend if you go there today. So again, if you go back to Taliesin, you'll be directed. They're running on the hour, okay? So there'll be an opportunity to have a look at SUSIM. Our accommodation we've already mentioned. Our info hub is where you registered for things like our accommodation team, our admissions team, and others. Plenty of catering outlets open across campus, and we always say for those that are not familiar and are not from Swansea, the weather was better, but if you do have an opportunity later today, explore Swansea and the wider area as well. Okay, so I think we can't take you all on one tour together because there's obviously too many of you. So what we're going to do is I think if we split the two outer sides, Ben, do you wanna, two of you wanna go with those on the outer side, and we'll take you to the teaching lab, so you'll get to see the teaching labs first. Those in the middle, we're gonna take you to clinical skills, and then we'll swap.